Uh, Hello all. Today we have Dr. Sujoy. He is a well-known fertility specialist coming from the Kokoda. He is head of the fertility centers of the Genome Fertility Centers in Kokoda. So we are honorable
Thank you.
to
Thank you.
accept you here in Origin Fertility Centers. So today we are discuss with Dr. Sujoy about the IVF. So nowadays we are facing the infertility couples with the infertility problems. What we want to do, we want to know is what is the IVF? Who should take the IVF procedures?
So IVF basically means the in vitro fertilization. In vitro means outside, and fertilization means this meeting the eggs with the sperms so that a woman can conceive. There are a number of few couples who can't conceive naturally, and they should go for IVF. There are few couples who can't conceive without IVF, like the couples who are having very poor sperm count or azoospermia, that is no sperm in the semen. There are some women who have lost both the tubes or both the tubes are blocked. Some women with severe endometriosis. Some women we call premature menopause, when the ovaries stop working before 40 years. And very rarely there are some men who can't ejaculate during intercourse. So they require IVF. Without IVF, they can't conceive. On the other hand, there are some other couples who can try other treatment. They can try naturally or they can try IUI. If all these fail, then they can go for IVF. Like women with PCOS, polycystic ovary syndrome, women with early endometriosis, uh, couples having mild problems in their sperms, or unexplained infertility, that is when all the reports are normal, sperm, ovaries, tubes, all are normal, still you can't conceive naturally then. And of course, the women who are having less number of eggs inside the ovary, we call poor ovarian result or low AMH. In that case, they can go for IVF.
Okay. So all the couples think that the IVF 100% success rates and those things that they're coming for those kinds of belief. So what is the real success percentage of the IVF?
Okay. First of all, the couples who are undergoing IVF, they have to understand what is meant by percentage or the chance. Last week, I got a couple in Kolkata. They have done IVF in other place, and they were told that the success is 99%, but they failed. Then they asked me, doctor, I was told the success is 99%. So why did I fail? I said, see, if I am saying that it's 99%, that does not mean that you will belong to that lucky 99% group. You may belong to that group, or you may fall in the unlucky 1% group. So is the chance like there is a match between two countries. So there is a chance, 40% chance that team A will win, or 60% chance that team B will win. That does not mean that team B will definitely win or team A will definitely lose. But remember, throughout the world, it's based on strong statistical data. The IVF success rate is not more than 40 to 50%. That is, throughout the world, if 100 women are undergoing IVF, 40 to 50 can conceive. That mainly depends on the age. The success rate is higher if the woman's age is less than 35, and if woman's age is more than 40, the success rate decreases. So therefore, overall the success rate is 40 to 50%. So you should have realistic expectation. At the same time, there are many couples who are conceiving after first cycle of IVF, and having said that, there are many couples who require 3, 4 or more number of IVF cycles.
I see. So what can what is the complication associated with the IVF?
Okay, by and large, IVF is a safe procedure. Majority of the women who are undergoing IVF, they don't experience any complications. It's just like crossing the road. When you are crossing the road, majority of the people will not face accident, but some of them can face accident. So the complications can arise in the initial part when we are stimulating the ovaries. In one end, the ovaries may not respond well. On the other hand, ovaries may respond excessively. We call it ovarian hyperstimulation syndrome. In some cases of this thing, OHSS, ovarian hyperstimulation syndrome, you can have bloating, you can have vomiting, you can have nausea, and it usually subsides after you have period next time. But in some cases, in 1% cases, it is so severe that you can accumulate some fluid inside your tummy or inside your chest, that your kidneys may not work properly. You may sometimes require draining this fluid, and rarely you may require admission to intensive care unit. Next is the procedure called ovum pickup, where we are collecting the eggs from the ovaries. It is done under anesthesia, so it is not painful. Very rarely it can lead to infection, bleeding, and some organ injury. And sometimes we may not be able to collect good number of eggs from the ovaries. Next, the embryo transfer, when we are putting the embryos inside the womb. It's a daycare procedure. It's a very short procedure. Usually does not require anesthesia. Anesthesia is administered only when the women are very much concerned and they request it. Usually safe procedure, but sometimes there may be some technical difficulties. We may find some challenges in putting the embryos inside the womb. And then the complication means sometimes even if you conceive, there is small chance that your pregnancy may not continue till delivery. You may have miscarriage, or you may sometimes have ectopic pregnancy, that is pregnancy occurring inside the tube. Not only women, there are some men who have to undergo something called surgical sperm retrieval. We call TSR, like testicular sperm aspiration, because they have azoospermia. They don't have sperm inside the semen, but sometimes we may be able to collect the sperms from the testes by putting a needle or making a small cut. Again, this is a very safe procedure done under anesthesia, maybe local or general anesthesia. But few men can face complications like pain, swelling, bleeding, and infection. But again, I will say these complications are not common. Very few couples can face these complications.
Thank you. And another one is if they have IVF pregnancies, is there any difference or any precautions and difference to the natural conception pregnancy?
Okay, once the embryos are put inside the womb, it's just like natural pregnancy, but you have to take some extra medicine for first 3 to 4 months. The rest are same like natural pregnancy. You have to visit your doctor regularly, you have to do the scan, you have to do the blood test, you have to take some iron, folic acid supplementations, all the things, all are same. But there is a misconception. Many times women feel that they should have absolute bed rest just because they have IVF. We have seen some women, they're saying that, doctor, I am a very busy woman, my daily life is so hectic, so I can't do IVF because I can't take rest. We said, you don't have to take absolute bed rest. You just follow what other women follow in natural pregnancy. So you took, of course, some restriction that we put in natural pregnancy, like avoid smoking, avoid taking alcohol, avoid taking radiation exposure. This apply for IVF pregnancy as well. So I think there should not be much restriction compared to natural pregnancy.
And another one is they believe that it's a test tube babies and those things. So the misconception is there any chance of the increase the fat in the IVF?
Yeah, I think this is the most important question. Many couple wants to know. I'll do IVF. Will it increase the chance of baby's abnormal? Remember, in every pregnancy, even in natural pregnancy, there is chance that baby may be abnormal. Overall, the chance is 1% in natural pregnancy. That is, out of 100 women carrying the pregnancy, in 1% cases, the baby may be abnormal. Mostly the reason is some genetic problems, maybe some environmental issues or some drug exposure, or maybe something like alcohol or some lifestyle changes, even obesity. This can lead to abnormalities. In IVF also, the babies can sometimes be abnormal, but it's not due to the IVF process itself. It's because of the causes that are associated with abnormalities in natural pregnancy. That is, the chance of abnormalities is similar between natural pregnancy and IVF. If a baby becomes abnormal after IVF, that does not mean that it's because of IVF. It's mostly because of the underlying factor, mainly the genetic factors. It can happen even in natural pregnancy. So IVF per se does not increase the chance of abnormalities in the baby. So we request all the couples who are undergoing IVF to rest assured that IVF is a safe procedure for your baby as well.
Okay. So the last question is, so how should the patients choose the right IVF centers, the fertility center for them?
Okay. This is a very important question. Sometimes patients are moving here and there from one center to another center, and still they don't get convinced and they don't believe in any center. So what we can suggest for them? First of all, see the success rate. See the infrastructure, the laboratory and other equipments, because IVF is particularly very much laboratory dependent procedure. Skill of the clinician is important, but more important is to have a skilled embryologist, because 80% of your work in IVF lab is done inside the laboratory. So it's important. And how they present their data on success rate. If IVF clinic is claiming that their success rate is 99%, I request you, please don't choose that clinic, because they're definitely telling a lie. So, and of course, see how they're treating you, and of course, people who are going to IVF because they're under stress, so they want to talk to someone who will provide them reassurance. So in IVF center, everything matters, like at the point where when the couple enters the IVF clinic, the receptionist, the nurses, doctors, embryologists, everything matters.
Okay. Thank you, Dr. Sujai. အားလုံးပဲဒီနေ့တွေ့ဆုံပွဲလေးကိုနှစ်သက်မယ်လို့ညွှန်လင့်ပါတယ်ဆရာတို့အနေနဲ့လည်းဒီဒေါက်တာဆူဂျန်ရောက်တဲ့အချိန်မှာအားလုံးအတွက်ဒီသိကျင်နေတဲ့မိကုန်းတွေပေါ့ဒါသူနာရဲ့အမေးများရဲ့မိကုန်းတွေကိုဒေါက်တာဆူဂျန်ကိုမေးပေးတာဖြစ်ပါတယ်အားလုံးကျေးဇူးတင်ပါတယ်